This is Voices in Validation, brought to you by IVT Network. IVT Network is your expert source for life science regulatory knowledge. Voices in Validation brings you the best in validation and compliance topics. We interview industry experts from pharma, biotech, med devices, and laboratories. Here is the host of Voices in Validation, Stacey.
Thank you, and welcome to another episode of Voices in Validation, brought to you by the IVT Network. Today, we're going to talk about the top 5 data integrity issues. Data integrity is a critical element to GMP compliance, and all life science manufacturers need to develop and maintain processes for managing their data, reducing the risk to integrity of that data and stored properly. Of course, this is all part of regulatory guidelines, which we're all familiar with, and they've been in place for years. Still, nearly half of all warning letters contain data integrity components. So here today to discuss the challenges due to evolving technologies, best practices and regulatory guidance, and highlighting the top 5 data integrity issues is industry expert Chris Wubbolt. So Chris, as I mentioned, it's great to have you with us today, and so great to be able to get your perspectives on the data integrity issues that we continue to see. You know, it's important that data integrity teams understand that these most common data integrity issues that are showing up in the warning letters found during inspection, not only does it help them to avoid making these same errors, of course, but it also assists in the creation of better programs and processes around DI. So let's dive in on the top 5 identified by our team. By your team, actually, not my team. Okay. So Chris, I know that you noted the first data integrity issue that you see a lot is inadequate identification and implementation of controls of electronic records. So what does regulatory guidance tell us about controls for electronic records?
Yeah, thanks, Stacey, and I'm glad to be back providing another podcast. And I wanted to just, these are top 5 issues that I've seen and people that are working with me. And you may not see these specific items on a warning letter or 43, but these ultimately are the cause of 43 or warning letter data integrity observations or findings. So you'll never find a specific finding that says inadequate identification and implementation of controls, but you'll find the specific details behind that. So what I've listed is actually what I've seen has been the root cause of many 43s and warning letters. So that's what I really want to focus on. And
that's perfect, Chris, because root cause, as we know, is what needs to be identified to remediate any issues. But so often organizations don't dig in deep enough to actually find the root cause. They're just sort of trying to put a Band-Aid on the issue. So I love that we're diving in, and these are from your perspective, going in and doing these audits of what you see to be really the root causes here. So just if you can, give us a quick overview of what the regulatory guidance is telling us currently about controls for electronic records.
Yes, so the regulatory guidance and actually predicate rules also, they include requirements for implementing appropriate controls to ensure the integrity of data. And so there are a lot of different things that you can have to review and maybe and ensure that you have in place to ensure that you have data integrity controls established. And that goes, the FDA guidance on data integrity, the GMP guidance states that you need to implement appropriate controls to prevent and detect data integrity issues. So that's really a life cycle process for me in terms of the controls that are needed. So you have to look at all the way going back to when you're actually implementing and validating these systems. What are the controls that are needed when you need to set up, when you're configuring or implementing or installing some of these systems? So the controls, are many times related to security in terms of accessing the system, the user roles that are established for the system, and then once the data is actually, and also appropriate configuration of those roles and and the system. And then once you actually collect data, there are processes that you have to evaluate in terms of how the data is collected. So it could be data, some systems, for example, allow you to hit a save button if you want to save a spectra, for example, for analysis, when you can also configure those systems to automatically save results. So, and that's really how you want to implement that control. Once the data is actually stored, collected, and then you store it, what are the controls associated with that? And then what happens to that data? Is it remain? I've seen this, I still see this lots of times where the data remains on a workstation or it's not backed up. So really identifying, knowing what the control, the life cycle is of your data collection processes, starting before you even begin collecting data, all the way through the disposition of the records and the data. Once you archive it basically, and secure it in the archived format, that you have to really identify those controls, identify what the process is, and then identify the gaps, and then ultimately implement the appropriate controls to prevent any data integrity issues from occurring at that point.
So excellent overview of what you're looking for, what the expectations are, Chris, and some ideas behind that. What have you identified as the most common GMP systems lacking proper controls? Like, what is the basis of the majority of the mistakes that you're seeing?
Yeah, so what I've seen a lot of times is, there are even simple systems that have the ability to collect electronic data, and there are people who are printing out paper records, for example. And I have another podcast that will go through that in more detail. Another area that I've seen inadequate controls are for standalone instruments and systems. Those systems that basically allow you to, that they're not networked, and you have to do some manual process to back up the data and secure it. And I've seen issues with those systems. Also, some automated manufacturing systems are similar to that. And then another area that I've seen is software as a service applications. I actually saw one, I was doing an audit of a facility, and I was doing a review of some of the configuration within the system. And I actually saw the software vendors, support personnel, we're trying to open a record as part of my review process, and the record was locked in the production environment by the vendors' help desk personnel, their support personnel. And the company that I was auditing had no idea why the vendors' support personnel, who have administrative access, who actually had controls or had access to their system. So you see a lot of things like that, and you really have to, the whole process for data integrity controls is not just looking at one little piece of the process or validation or audit trails or backups. It's really, you have to look at it holistically. What are the appropriate controls for the entire system? And each system is different. I mentioned simple laboratory systems like even balances, or simple systems like filter integrity test units, or standalone instruments, or software. They're all different types of systems. So you have to really go through and identify what the process is for each one of those different types of systems, and what the controls are that are established, and then see what the gaps are, and then implement those controls at that point.
Yeah, that makes total sense, to be more holistic in your approach and really understanding what each of your systems does and how they need to be treated, separately, but also as part of the whole, right?
Yep.
So the second item that of the 5 is inadequate procedures and training governing audit trail review. And I know you just mentioned audit trail as one of the elements that we're looking at. Can you share some examples of this?
Yeah, audit trail review. People have asked me about Part 11 and data integrity, and to me, they're very much they're the same thing. Different aspects of it. Part 11 is much maligned, of course, in industry. Back when it first came out, there was a lot of confusion about Part 11. but it has a lot of good controls in place that were good requirements that there are expectations. 21 CFR Part 1110 is the controls for closed systems, and the first control is validation of systems, and part of that is to I think it is to detect invalid and altered records. To me, that sounds like a data integrity regulation. So, and then the difference between, what are some of the differences between what Part 11 stated way back in 1997 to data integrity? One of the things that I've seen, and I don't think the difference was intended, but Part 11 requires an audit trail. And so all these systems now have audit trails, or most of them do, they should. But then what was not stated explicitly in Part 11 was that audit trails need to be reviewed as part of the original record or the true copy of the original record. And otherwise, you're not reviewing the complete data. So what I've seen is many times the audit trail records are not reviewed adequately. So I've actually asked people to, when their SOP said that they are required to review audit trails, I've asked, and that's something I do during assessments, I actually ask the data reviewer and show me what they look for when they review data, and that includes the audit trail. And I've asked people to do that, and they don't even know how to access the audit trail. So and then sometimes they do know how to access the audit trail, and they are very good about what they actually review. But then that's that one person who's the data reviewer. But then the next person who might take over or is a backup, or if they're busy, might support that. They may not have that expertise. So what I've seen is that the SOPs then do not describe adequately what should be reviewed for in the audit trail. And all these systems are all different. As I mentioned, they're all different. There are many different types of audit trails: system audit trails, system logs, history logs, and raw data audit trails, and so forth. And for different types of systems like chromatography systems or UV-Vis systems and things like that, even things like building management systems, there are different types of things that you should look for in the audit trail. So you don't just look at the audit trail and just review it. You have to know, because there's a lot of information in these audit trails, and a lot of it is important, but not really that important from a review perspective. So I think you really need to define, for almost at a system by system level, these are the things that you should look for when you're reviewing this audit trail. Also describing how to get into the audit trail. I once did a data integrity assessment in Tokyo, and I did the same thing. I asked the SOP said, review the audit trail. That's pretty much all it said also. And I was able to, it was in Japanese, but I was able to use my Google Translator to actually review the SOP on my phone. So I actually when I went to the lab and asked the data reviewer to show me how they reviewed the audit trail, and there was no checklist too. What they did was they opened the audit trail, and then they looked at it, and then they closed the audit trail. They really didn't know what to look for. They weren't even chemists. They were, I think, in document management. So I've seen that a lot. I mean, just like Part 11 required audit trails, but did not explicitly state review audit trails, although that was the expectation. You don't want to just have audit trails that you look at and then close and not really know what you're looking at.
So in your experience then, because I hear what you're saying, the audit trail is there for a reason. Obviously, you're supposed to be reviewing it for a purpose, not just opening and closing it. How much review of the audit trail records is necessary, and who's responsible for the records management? Is it just, it's not just the audit reviewer, it's not just the data reviewer, right? So can you talk a little bit about that?
Yeah, well, that could be a separate podcast, actually, in terms of the frequency of audit trail review and who does that. But generally, you have to, what they recommend, of course, is a risk-based approach to determining the frequency of audit trail and who should review it. So but generally, if you have a raw data that is being used, that's collected from an instrument that's being used for release of material, for example, then the audit trail should be reviewed each time as part of the release of material process. So, if you look at, if this is all paper, this is how I look at it. If this is all paper, these are all paper records, and you review the paper records, you can see the handwritten single line cross out, initial and date, and so forth, reason for change. And but when you review the paper, you see that, and that's part of your decision-making process when you release or reject material, for example. And so that's to me, the rule of thumb is for release of material, you should review the audit trail at that point to determine as part of your review process. And they're different, as I mentioned, there are many different types of audit trails, and system logs and administrator audit trails and things like that. So you have to really look at the risk, and that will help you determine the frequency of audit trail review and who should do that.
Thank you. So the third point we're talking about today is inadequate validation of electronic record keeping systems to demonstrate intended use. And validation is critical to ensuring an electronic system is correctly performing its intended function. What does that include, Chris?
Yeah, well, to me, validation is intended use, demonstrating that the intended use is functioning as the system functions as expected. And so many times I've seen validation focusing primarily on testing the system. And I always try to say that validation, there's a difference between testing and validation. Testing is showing what the system does, and validation is showing that the system does what it's supposed to do. So that's a key system. And when normally there's a user requirement specification or a specification that defines the intended use, and oftentimes it's incomplete. So if the intended use, the requirement specification is incomplete, then when you do your testing against that specification, and everyone should have a trace matrix, of course, then if the user requirement spec is incomplete, then your system you haven't fully defined how the system is intended to be used. An area
so you don't really have a benchmark that you're trying to get to, right? So you can't really say, hey, this is doing what we intended it to do, because you don't really know, you haven't written down what you intend, what the full intent is. Is that correct?
Well, it's a false sense of security. So you think that you're following this method that this validation approach and following GAM5 and this and that, and but then you go through and you test all the requirements, and then but the requirements are not complete. And the area that I've seen that a lot of areas is really user roles. When you use a system, there are different user roles. So there's data entry, there might be read-only, there's approvers, there's administrators, supervisors, and that's how you intend to use the system: data entry and data reviewers and supervisors and so forth. And many times I don't see actually user roles stated within the user requirement specification. There might be a spec that says, and sometimes not even this, there might be a spec that says the ability to create user roles. But if the user requirement spec is really the intended use of the system, and that's what the basis of validation is, then you should define what those user roles are and how those roles are intended to be used when you're using the system. That's a pretty simple way of doing it, actually. And then I have seen some issues with sometimes people say that security, for example, is a non-functional requirement, which to me is not correct. But and then those non-functional requirements are not stated within or not included within the trace matrix. So those non-functional requirements related to security, again, I believe they are functional requirements. They're functional requirements related to security, but those non-functional requirements that are not tested or verified. So you don't know if the password controls are set up properly and things like that. So that's what I've seen. And then again, if you don't fully identify the intended use, then you can't really fully validate the system, or it doesn't link up or sync up with the trace matrix, for example. And so that's a an area that I've seen. And then when somebody asks a question, well, they show how the system is being used during a demonstration, and then they ask a question, is this part of your validation? Is there a specification for this? And I see this a lot. There's no specification that defines that feature or that workflow. A lot of times you see that for Part 11 calls it operational system checks, where you have a workflow or some steps that need to be completed before you can do the next set of steps. And there's no testing for that. So and that's partly because the user requirement may not define what the intended use is in that aspect. So that's what I've seen, and I think a great way to actually develop an intended use document or user requirement specification is by doing a data process map, or not even a data process map, but a process map of how the system will be used, with swim lanes for the different user roles, and starting with how data is entered, ending with what the output is, which is usually data or a report of some type, and or control. And then at that point, using that as the basis for your user requirement specification. So that's what I've seen for, again, that you will see 43s and warning letter citations for inadequate validation, but they might have a very specific example. And the bottom line is the root cause is that the user requirement specifications, which are the basis for validation, are not complete, and they don't fully define the intended use of the system.
So much great information there, Chris. I'm just still thinking about the record keeping systems for another minute here. And in addition to issues with user roles not being identified or defined, how else or what other things can an organization do to improve record compliance and reduce time-consuming tasks around things like record storage and retention?
Well, one way to reduce time-consuming tasks is by automating processes, and again, those processes should be validated. So I would, again, I would recommend automating these processes, so you're avoiding manual backups, for example, or other things like that. And I think automation is the key. If even going back to worksheets in the laboratory, if you have or laboratory notebooks, let's say, and you identify each laboratory notebook with a number, a unique number, you issue that to a chemist or an analyst, and then they complete their work, and then you have to reconcile that. If you have an automated process, then you remove that whole set of processes about an SOP on issuing a laboratory notebook, the processes on completing that notebook, and then also the process to retrieve that notebook and then reconcile that notebook, so that that it's not laying around at the lab somewhere, or it's been taken home by mistake. So automating these processes can improve compliance for sure. And again, we'll talk about paper processes later in another podcast probably, but if you can automate these processes, and using automated systems helps you to improve compliance if you validate those systems appropriately.
Yeah, I totally agree. And automation, as we both know, is a topic we could dive deep in on in another episode, because there's a lot around that particular topic as well. But I agree that automation, not only, it not only makes it more, less time consuming, but it also reduces risk, some of the risks around manual activities. But let's move on to number 4 in your top 5 list here, which is inadequate user management procedures. So what are some of the top errors in user management, outside of course, the user roles that you've already discussed?
Yeah, well, a big part of user management is really, and most companies have this in place, not all, but most do, where they have procedures on how they authorize users to become to use systems. So there might be some forms or tickets that are generated that are completed that would allow a user to become a user of the system. Part 11 has control for authorized users. So management signing off and saying this is a user that we want to give access to the system at this specific role. There's also a control in Part 11 for authority checks as well, which is, so if you have a user role, user needs to gain access to the system, they go through their training, they read the recipes, and then they are assigned access at the different user groups that I mentioned, such as data entry or approver and things like that. So most companies have that in place, and that is an expectation. But what I've seen oftentimes is that there's not really a procedure or process to periodically check the user roles or the users within the system to ensure that they still have adequate, they're still assigned the adequate role, or even if they've left the company, that they no longer have access to the system. So those, and that may happen sometime, that should happen, that those periodic reviews, and there should be a procedure for that, and those procedures, those reviews should be documented. What should happen is that when someone leaves a company or changes a role, their role should be changed automatically. Well, not automatically, but by procedure when that occurs within 1 day or 3 days, depending upon the process or the procedure. And then you double check that every, what I've seen for more typical roles is on a yearly basis, an annual basis. And then for more what I call privileged roles like administrators, maybe on a quarterly basis. So, I don't see that sometimes where those procedures are in place to ensure that the roles are adequate and there are no extra no users that no longer use the system because of they left
that. I mean, that seems obvious that if someone's not working for the organization any longer, that they should obviously be removed. So is that something you're seeing quite often or occasionally?
I'd say
what's the likelihood of this happening here?
You should never see it because there should be controls in place for this, but I still see it, I'd say about 25 to 30% of the time, where one of those elements of user management are not being addressed adequately. So again, most companies have procedures, not all. So I'd say about 10, even this is high, but 10% may not even have a defined procedure and documentation to support authorizing a user at a certain authority level. But then the actual process for periodic reviews, and sometimes there might be a procedure that does require a periodic review, but it's not being followed, or if it is being followed, it's not being documented. So I'd say that's probably about 25% of the time that I see that. So it actually happens in this day and age, with all the focus on data integrity and security and so forth. You still see it pretty frequently.
Digging in a little bit deeper on the same point here, help us understand what kinds of technical controls or user schemes are necessary to reducing risk and maintaining compliance.
Yeah, that's a good question. And what I've going to go back to user groups or user roles. So you can assign users to systems a couple different ways. One, you can assign each user specific roles that you establish within the system, or give them specific privileges, so and not really assign them to a user group. And then the second way to assign users to a system is by saying we have an established group of this type of user, data entry, for example, or data reviewer, and we're going to assign this new person who's been trained and qualified to a user group. And so I prefer the second method, assigning a user to a user group, because you can, as I mentioned, if you have adequate validation, you can validate the security processes around user groups. You can define what a user group data reviewer, for example, is supposed to do, what privileges they have within the system. And then once you have a new user, then you just assign that user to that user group. You can validate the establishment of user groups if you have an adequate validation. What I've also seen is assigning users to the system, and then assigning, when they're in the system, assigning privileges to those users, not necessarily the same privileges for each user, but whatever they happen to need for whatever they're doing. And in that case, then you really can't validate that, because the person that's setting up the roles within, or the user within the system, there might be, let's say, 10 different features that they may have access to, and the user is required to have access to 7 of those features. And the person that's setting up those features might set them up. They have to set them up manually if this process is being followed, and no one checks to make sure that that person, usually it's an administrator, that administrator sets up the role, the user within the system, with those 7 specific privileges. And so again, it's not a group that you can say, we're going to validate the privileges within this group. This is all done outside of the user group process, so it becomes operational. And so what I've seen is that many times there might be an administrator that sets up these users independently outside of a group with specific defined privileges, but then no one is verifying that the administrator has set up the roles appropriately based upon the request that has been made. So again, a technical control, it would be to always use user groups that you would validate to ensure that the user, and again, you can validate that the user groups have their privileges. And then if the user groups change their privileges over time, if there's a new procedure or new process, then you go through change control to update that user group within your validation process. But if you have an individual user that is assigned specific privileges within the system, if you don't verify what those privileges are and that they've been set up correctly by a second person, then there's definitely a risk that maybe someone has been set up properly. And I've seen that also, where someone has more privileges in the system than they really should have, because of the administrator didn't set them up properly, and it was an operational process.
So part of your SOPs then, it sounds like, really should be that an administrator is setting these user groups and user roles up, but that a second administrator or someone else from the team should be in and just reviewing that, making sure that it looks as they expect or as it should.
Yeah, well, user groups you can validate because those user groups are the same. So that's done, that second review is actually done as part of the validation process. But it's when you have a user,
The individual.
The individual types of roles that might be, a spot chosen, if you want to call it that, and then someone sets it up, and then they assume that it's correct, but it's pretty important in some cases, some of these privileges, and if they're not set up correctly, then the user has access to features that they're not intended to have access to. Again, let's talk about intended use is really what validation is, demonstrating that the intended use is functioning as expected. So if you set up a user inappropriately without a verification step, then you're not using that system as intended. The FDA could state that that's not a validated system.
Gotcha. Excellent. So let's move on to the 5th point in the top 5 here, which is inadequate risk assessments of electronic record keeping systems. I'm just going to ask you to quickly highlight the biggest issues here.
Yeah, well, out of the 5, this is what I think is the most important. And again, you may not ever see a 43 warning letter that talks about inadequate risk assessments, but this is ultimately the root cause of many of the data integrity problems. And I'm a big fan of risk assessments. ICH-Q9 is
right.
Management, and that's a good tool to use. And the FDA guidance also talks about the knowledge, business and technical knowledge to perform risk assessments on your business and technical systems or processes or something like that. So in order to do risk assessments, you really need to have knowledge of your systems. And that might be, again, that can apply to standalone systems. It could be applied to network systems. It could apply to systems that are hosted by vendors. You have to know what your business processes or the technologies that are used and the controls that are established by software as a service vendors, for example. What are they doing versus what your responsibilities are? How are they maintaining your data within their computing environment? So really, doing an adequate risk assessment is really having knowledge of your system. And I do data integrity assessments probably in a 4-week month, probably 3 weeks out of the month. So I do these a lot. And what I see a lot is that people don't really know, administrators or users don't really know the system like they should. And many times when I do these data integrity assessments, when I'm finished, I know more about the system than in my short data integrity assessment that I do for each system. I usually end up knowing more about the system than even the administrators do, and that's a big risk, because if you don't know what these system features are and these functions, then how do you know that you've set them up properly to ensure the integrity of data? Even knowing things like error messages or warning messages that might be received, and oftentimes there are logs in these systems that are error message logs. And if the FDA or somebody reviews those logs and they ask, what does this error mean? Or even this warning, and you're not sure what that means, then how do you know what the impact of that error is, or that message is on the integrity of the data? So again, risk assessments, anyone can do a risk assessment, but the more information that you know, the more knowledge that you have, the better the risk assessment can be. And the better the risk assessment, the more likely is that you're going to identify data integrity issues. And then you'll be able to, once you know what the issues are, then you can implement controls to mitigate those issues. So it's kind of, that was the first item that we talked about, inadequate identification and implementation of controls. And that's because of inadequate risk assessments, and the risk assessments are inadequate because people don't have the knowledge or the awareness of what these different options are within the system, and these different configuration items, or the ability to how data is saved or where it's saved to. They don't have that knowledge, or what the error messages are. And then again, if you don't have that knowledge, you can't do an adequate risk assessment.
Sounds like a vicious cycle here, Chris. and I would agree. The risk assessments are necessary. I mean, I hear folks talk about them all the time. Some people dread them, but ultimately they really help us understand the potential weaknesses in our systems, and in this case, record keeping systems. And all of that seems very fundamental. You're talking about why it's important, all of the different things you can learn from it. What are the difficulties? Like, why is it so challenging to get a proper risk assessment done?
Yeah, well, I think a lot of people don't have the, first of all, they may not have the time, or they've never done it before, so they don't know how to do it. And also it might be that they don't have the tools in place to actually conduct a risk assessment. So everyone talks about risk assessment, ICH Q9, I mentioned. That's specific to overall risk assessment processes and tools. You can use many different tools that are identified in Q9, ICH Q9. But what are the appropriate tools for our data integrity risk assessment? And I think people just they don't really know what that process is, or what the tools should be. That actually could be another podcast or webinar specifically on how to do these risk assessments, so that you do identify what the risks are, and you get a better understanding and knowledge of these systems.
Yeah, I think that's a great idea. Doing some sort of working workshop where people can actually see you go through the process and maybe bring some of their own challenges or information to the table. But since you mentioned tools, can you just briefly outline what some of the best tools to help teams are to get more, comprehensive assessment of records and information management activities? And obviously they can hire a consultant like you to come in and help them do it, but are there other tools that they can bring in internally to assist with this?
Yeah, I think that there are tools and that you can use. And I'm not a big checklist fan, because I kind of feel they're limiting, and people are too worried about completing the checklist rather than thinking about the the responses or the answers that they're recording, and really, I'm not sure that checklists contribute to critical thinking as much. They can for sure, but they're definitely they can be limiting as well. So the tools, the process that I normally follow is to first really understand what the system is doing, and I'll go through when I do a data integrity assessment. I spend a lot of time actually at the system, not just looking at documentation or paperwork and so forth, or electronic paperwork. But I actually spend time, and I need to see someone that is actually using the system, a typical user. And then I need to see what I need an administrator to support that process. And I'll actually go through each menu item. I'll watch the user, how they use the system, how they collect data, and you can get a lot of information just by watching them and asking questions. And then also then I'll go through each menu item with administrators, see what each feature does, what each menu item does, and go through that process. I'll use that then information with a lot of notes, and then I'll put that again. I like data process maps, data flow process maps, and putting those together so you can actually have a process of the data, how it's collected, and all the way through disposition. And those are useful also during regulatory inspections, when you can show the regulator, when they're asking about your system, say, oh, we've mapped this out, and here's what our data flow process map looks like, and this is where it's collected, the controls are in place, where the data is transferred to, how it's reviewed. And we did a risk assessment based upon that data process map, and also the interviews with the people that you're interacting with, of course. And then at that point, we identified these potential risks, and now we're going to, we've mitigated those risks through adding another utility or tool that checks this automatically, or an additional reviewer process that we follow, and things like that. So those are the types of tools. So normally would be it's a tool. This isn't a tool, but a process, a thorough understanding of the system, data flow process map, and then using that to identify risk scenarios and failure modes for what could occur if there are not to the data, if there are not controls that are adequate controls that are established to ensure data integrity.
Excellent. Some great tips or things for people to consider, tools for them to use, some things to look out for. This was excellent to go through these top 5 data integrity issues here. And I just wanted to say another problem that many organizations are facing that I've seen with their effort to improve record risk management and data integrity is this transition to digital formats. And I know we have another episode coming up in a few weeks where we're really going to dive in on the paper versus the electronic records. So you don't have to go, into great detail here, but can you briefly discuss the differences in this, top 5 list for this, in this top 5 list here for paper record keeping versus electronic records?
Yeah, well, I think with an appropriately validated system, adequately validated system, that you could definitely reduce errors. You can minimize compliance issues. Because of that, you can make processes more efficient. And even if you're looking at, this is data storage or record storage. If you're looking at paper records, you're looking at shelves and boxes in a temperature controlled environment with pest control and backup generators and things like that for paper records. And some of these, if you've ever been to a document repository like Iron Mountain, you know that these are massive in size. So just by itself, all that data in an Iron Mountain facility, that's paper, just there by itself, if you make that electronic, that's on a, I wouldn't suggest using a thumb drive, but you can save all that data on a thumb drive. So just looking at that in terms of the efficiencies that are implemented, and the, if you're relying on manual reviews and checks for some of the data and the controls, then you can actually automate that. Again, you have to validate that intended use, but you can actually automate that to do those checks automatically. I do think that there's a big benefit for going electronic data reviews, and you can actually identify compliance issues more easily with an electronic record as opposed to a paper record. And regulators are looking at, if systems have the capability to save records electronically, then they're expecting you to not just rely on that printout, but rely on those electronic records that have been able to be collected and then even transferred to a LIMS or a laboratory or a secure directory of some type. So those are some of the definitely the differences, and I think they're all, if you do it properly, they're all positive when you go to an electronic format.
Absolutely. And of course, like I said, we will talk more about that in another episode where people can really get more information about the pros and cons for paper versus electronic, but also really understand more some of the best practices around paper, if that's what you're still using, and electronic systems. So thank you for that. And as always, this is a great overview for our audience and will undoubtedly help DI teams in their compliance efforts. Before we wrap today, though, Chris, I want to see if there's any last thoughts or action items you'd like to leave with our audience.
This is, this is all, it can be challenging, but really we have to look at these systems critically and not necessarily rely on maybe templates or checklists to go through these processes, but really looking at the controls. And again, there could be different controls for different types of systems, software as a service versus standalone versus balances, for example. So look at these systems critically in the processes, and don't think about the way we've always done it, because that's not how we're doing it anymore. So critical thinking is the key, and knowledge of these systems and processes.
Great point. Thank you, Chris. I really appreciate you being here again and being our guest this week and sharing so much information with our audience.
Anytime. Thank you very much.
Absolutely. I also want to give a shout out to our producer, Ben Kitchen. And lastly, a big thank you to you, our valued listeners. If you have topic requests or guest suggestions, you can message us via LinkedIn or through our website. If you enjoyed today's episode, head on over to your podcast player of choice to subscribe, rate, and leave us a review. Plus, don't forget to share with your friends, colleagues, and online networks. We really appreciate your help in spreading the word. For today's show notes and resources from this episode, please visit www.ivtnetwork.com/podcast. We'll be back again next week with another great discussion. Until then, make it a great week.